live. So welcome to today's discussion on A Nightmare on Elm Street. So, anybody like to start? Any character? Wait, Freddy. All right, you know Freddy. This is new. He's not usually our first.
Oh, okay.
Good for you, though.
Do people generally pick Manson?
Listen, I'm not going to point fingers. We're not going to make this any weirder than it already is.
You know my mind all the time.
Right?
I guess the question is like, is he? I guess the very basic, essential question is he real or is he? Is he real or is he a part of their dreams? The children, I guess children, but the teenagers.
Right. So, if you chose Freddy as the object of our analysis, I think we should assume he's real. Right. I mean, as a psychiatrist, I hope that when someone presents to you with a chief complaint, you're not entertaining whether or not what you just saw and who you just spoke to is real or not, because then the object, the focus of clinical attention will be you. So let's assume, for purposes of this discussion, Freddy is real. All right. Having said that, I do want to do a complete 180 on this, and not even from necessarily the teens' perspective, but from folklore as a whole. We'll get to that later. Freddy the patient. This is going on. Well, let's start out with choice A, mood anxiety cluster. Choice B, psychotic dissociative. From this character's perspective, A or B?
Can I ask a question? Is
Always.
Freddy the patient the one as we see him in their dreams, or are we talking about Freddy the patient from? I
think all the above. We have to draw the timeline because they're the same person. Right. So A or B?
Probably would be, right? Yeah.
So you think that Freddy Krueger is struggling with a psychotic dissociative spectrum disorder? Fine. And there's no wrong answer. This is just the path you chose to take to get to our final answer, right? Single best answer. So if B, then what single illness would we choose as a group arbitrarily to begin to work from? Anyone? It's always schizophrenia. It's got to be, right? And that's because we arbitrarily chose that. Well, I chose it for you day one of your rotation, but we're going to stick with that. And the idea here is we're just choosing a path, an algorithm to work through to get to our single best diagnosis. That is, anytime we think that an individual might be struggling with a psychotic dissociative spectrum, we should always start with schizophrenia. Whether it's a person in our clinic, whether it's a film we're discussing, whether it's choice C, D, or A. Give me the diagnostic criteria, the 5 inclusion criteria for schizophrenia.
Auditory or visual hallucinations.
1.
Negative symptoms.
2.
Delusions.
3.
Disorganized speech.
4.
Disorganized behavior.
Perfect. We need 2. Does Freddy rule in?
Guess not. Right? I mean, I could see him having the disorganized behavior. His speech seems to be
If that's the case, you chose psychotic dissociative spectrum, so we now at this point, if we're all in agreement, now I should say for teaching purposes, if you were able to give me one, if he clearly demonstrated, for example, disorganized behavior, I would say, you know what, even though we know the DSM threshold, the APA threshold is 2 or more, we should still say yes, he rules in for teaching purposes only to see where this takes us. I'm not so sure we have a definitive yes on disorganized behavior.
Yeah.
Okay, and this is the slasher genre. I understand what he's doing, but it's organized and premeditated. So I'm not sure we can. So this is a first. So at this point, let's push into the dissociative spectrum since we chose psychotic dissociative, and now look at 3 dissociative disorders. Does anybody know what the 3 dissociative disorders in that chapter of the DSM are? 1.
Dissociative identity.
2.
Dissociative fugue.
And fugue, I'll give you a half point for that one.
It goes under amnesia.
That's it, right? Amnesia, the 3, right? And my next question, you stole my fire. Boom, stole my fire. Amnesia may be with or without fugue, right? Some seemingly purposeful travel away from one's home to assume a new identity, right? Or often assumes a new identity. All right, so working our way up, and in each case, you have to let's not do that. Let's work our way up. The mildest form would be considered depersonalization / derealization disorder. Do we think that Freddie rules in here? So does Freddie experience periods, episodes, where he believes that either himself or his surroundings are unreal in some way? Probably not, right? I mean, he's certainly the unreal nature of a lot of other individuals' derealization, but I don't know if he does. Dissociative amnesia? Does he have gaps in memory that cannot be explained by ordinary forgetfulness?
I don't get much insight into his mental picture, so, or his thoughts or anything.
I think we're figuring that out.
So, he might, but we don't know.
If not, then does he have DID? Does he have distinct personality states, one or more, that take over his conscious awareness and guide and govern his behavior? Not either. And in each case, if we had said yes, of course, we'd have to look into medical conditions and or the effects of a substance that might otherwise explain before we actually then arrived at that single best diagnosis, which we can't arrive at. Right. So, taking us down the psychotic dissociative path really hasn't really cleared things up for us diagnostically. So as a default, let's go to a mood anxiety spectrum. And here, what illness do we have to start with, or should we start with arbitrarily? MDD. Does Freddy Krueger rule in for major depressive disorder? Yeah. I mean, again, to start with a strict definition, we would expect him to demonstrate either depression or anhedonia. Now, it's a little bit tricky here because while that is true for the DSM, what I think in clinical practice is becoming more and more evident is that in males, depression may be replaced with irritability. And there are reports, there are actually studies that have been published that show that if you remove depressed mood and replace it with irritability, that the 2-to-1 ratio, women to men, with regard to this illness, equalizes 1-to-1. Yeah. Might Freddy Krueger be deemed irritable? I think that's a pretty safe bet.
A little bit.
Right? Even for the 80s, right? So let's say he has that cardinal trait, 4 or more from Ziggy Caps.
We'd have to get more information from him, but from what we see, I don't think so.
Even if we gave him sleep disturbance, which is the whole theme of the movie, and we pinned it all on him, we have 2. I'm not sure where it goes from there.
He seems to be able to concentrate.
Fair?
Significant changes in energy.
Yeah, I'm not getting it either. All right, so now we have to broaden our differential to include the anxiety disorders. Okay, so now I want you to think the rest of the depressive, the rest of the mood disorders, which of course then would include bipolar and related, and then the anxiety disorders. Anything jump out there? I mean, the anxiety disorders we could fairly quickly rule out for Freddie, because the way we would begin to evaluate this in a clinical setting is to ask, do you consider yourself a nervous person? The only real answer that guides our clinical judgment here is when your patient tells you no. Because when your patient tells you no, that has a very high negative predictive value. I would suggest that Freddy Krueger would tell us no. I don't see him saying yes to us. Right? So I think I think for now, for this diagnostic discussion, the anxiety disorders would be off the table, which means that we're dealing with the rest of the depressive disorders beyond major depressive disorder, as well as the bipolar and related disorders. And I'm not sure we could really come up with something. Third phase, right? So now we start this discussion with A or B. Now we have to acknowledge that there might be a choice C here, which is other. And when you get to this point in your evaluation and your formulation, I would kind of go a complete 180. And I would say instead of starting with a particular type of disorder, I would actually have the patient themselves guide us. That is, what do you think Freddie's prevalent theme / cardinal trait is? So this is now patient-centered. This is working in the opposite direction.
Social trait?
Antisocial, it's hard to dismiss. Unfortunately, while we could pursue antisocial personality, meaning that the individual's personality is hallmarked or characterized by a blatant disregard for and violation of others' rights, which again, very difficult to argue against that, we would still have to rule out a primary mental disorder. So I agree with you. Let's put that as a provisional on Axis 2, but we have to rule out a primary mental disorder. And then if we're able to do that, then we have to look back and see if there's evidence of conduct prior to the age of 15. I think Freddy Krueger is a primary mental disorder that explains his antisocial traits. And the good news here with regard to, the less than direct method we took to get here is that it's pretty explicit in the movie. And that is they hinted at the diagnosis. We know that he has a mental disorder. Who was Fred Krueger?
Child killer.
Yeah. And I think that goes hand in hand with antisocial personality. Okay. Let's leave the idea of the mental disorder that we may have to entertain for a later discussion, because I think we arrive at that through case formulation of other characters. So for now, our provisional diagnosis for Freddy Krueger would be an Axis 2 pathology, and that would be the antisocial personality. However, our evaluation is not yet complete because I'm not sure we have investigated and have definitively ruled against another mental disorder. To be continued. Second character. Any other characters you want to discuss here? We're talking about A Nightmare on Elm Street. Nancy. All right. So now what I want you to do is run the same exact algorithm through your mind and just begin to summarize what you think it might be going on with Nancy, where you think this is going. Just so we don't bore anybody watching us by doing the same discrete steps again. Taking those into account, what's going on here?
Well, she has considerable nightmares, which are fairly distressing. One of the themes I thought the movie touched upon was it was a perfect metaphor for nightmares versus sleep terror. I thought that was the overall. That's the biggest psychiatry tie-in that I saw. The fact that she can actually remember her dreams is suggestive of a nightmare disorder.
Yeah.
But aside from that, there were elements that it doesn't quite agree with that. There were certain parts of the movie that weren't congruent with that, because typically during REM sleep you have complete paralysis. There was a scene where when they were doing the sleep study in particular where she was essentially convulsing. So that's inconsistent with REM sleep.
Mm-hmm.
Also the fact that she also gets into REM sleep in the order of several minutes, which is also...
I actually timed it once. I have it in my PowerPoint. And in a matter of seconds,
Oh,
she did. Yeah. Got the little stopwatch. You're always carrying your cell phone anyway, so I just figured bring the stopwatch up. Let's see how long this day was. I have to look it up, but it's my PowerPoint. Yeah.
I would assume it was in the order of minutes.
Yeah.
So it's still largely inconsistent with that, but these are just some of the concepts that I thought about.
All right. So again, I think I totally agree with you. So just kind of reformulating this, I think we would go down probably a mood anxiety spectrum.
Okay.
And I think that certainly with the prevalence of nightmares, it wouldn't be out of context to look at those mood and/or anxiety disorders that have some form of insomnia as the diagnostic criteria. And that would include, yeah, that would include PTSD in addition to the depressive disorders. All right. I do agree with you. I think this is nightmare disorder. I do not think this is sleep terror disorder. However, I can't really rule out a primary sleep disorder here too because of your observation. So while I think initially I want to attribute her nightmares to a larger illness like post-traumatic stress disorder, and we should investigate that further, there's something about her sleep that is suggestive of yet another sleep disorder that is likely co-occurring here.
I was going to say, going along the lines of the decreased REM latency, probably narcolepsy.
That's exactly it. Yeah, this movie's about narcolepsy, right? Because we know that people like Nancy who are awake and alert, who have a narcoleptic episode, who REM during the beta state or the alpha state, will actually experience visual hallucinations, right? Because they're dreaming during wakefulness. So it's REM intrusion into the wakeful state. It's exactly who Freddy Krueger is. When you view this movie through the eyes of someone other than Freddy himself, it's about narcolepsy. So the rumor has it is that Wes Craven did not like the title Narcolepsy on Main Street. He didn't think that would actually sell in theaters. That's a joke. That's what the movie. Oh. If what we described in the cab, you guys missed the cab fare. That was a little weird. I'm glad I didn't get that on tape. The door shut on us. All right. Who does narcolepsy affect?
It primarily occurs in adolescence.
Yeah.
Period, right?
That's right. Right. Exactly right. And remember too, what is the distribution with regard to women and men? It's 1-to-1, which is great because there are 2 women and 2 men that are afflicted. So this movie gives it away. Right. Onset is in adolescence, and it's a 1-to-1 ratio. So perfect. Wes Craven nailed this one. Narcolepsy on Elm Street. Right. There's also an HLA association as well, right?
Oh yeah, so there's a genetic component, which is consistent with the movie too, because the parents are sort of in the overall theme of the movie as well.
Through the etiology.
Yeah.
Yeah, the parents are the etiology of the children's narcolepsy, which again is the HLA-DR association. DR4? You're making me think 2 decades back. If that's right, it's a mere luck. Yeah. All right. So we have narcolepsy in 4 characters here, all adolescents. Good. What about the anxiety disorder? What about post-traumatic stress? What do we need to look at, evaluate for to maybe rule this in?
First significant trauma.
Anything?
The flashbacks with Freddie when they were all kids.
What happened when they were kids?
They were molested by.
There were like scratch marks on her back and
Yeah, so that's not explicit in the movie, but I think there's enough there to suggest that these were 4 victims. At least the main character was.
the way he spoke to Nancy.
So she's the only character that was not killed. Right?
Probably so. I'm not sure the role of the other 3 friends. They may have not been captive,
Okay.
but I think Nancy was.
Yeah.
I think Nancy got away, which is why he really focuses on her. Remember, he kills the other 3 friends very quickly. He takes his time with Nancy, right? Which again might actually play to why she's the one who's obviously the central figure, and why she has these nightmares that become the focus of clinical attention in the context of post-traumatic stress. There may have been real sexual trauma here. Any other evidence in this film, scenes in this film, to suggest that this might be the case? You mentioned scratch marks. There's another bruise that she inflicts that I think is consistent with.
Oh, she like burns herself.
Yeah, when does she burn herself and
She's in
why?
the car trying to stay awake.
Right. There's another time too she does it. Earlier in the movie.
In the high school classroom.
So she dissociates, which is common for PTSD. She goes into a dissociative state. She dissociates, and then she burns herself to actually bring herself out of that dissociative episode, grounding herself, which is consistent with individuals who suffer from post-traumatic stress with a psychic numbing that is diagnostic of the illness. Right? Some people cut, others burn. And Nancy burned herself in that pipe to get her back to the here and now. So that's consistent with post-traumatic stress. Anything else? There's a weird scene in this movie following the polysomnography, which again I think is diagnostic of narcolepsy. But by the way, for your shelf exam, what specific type of sleep study is ordered to rule in or rule for, evaluate for narcolepsy? So it's called the multiple sleep latency test, where an individual actually undergoes several short naps, right? Where you would not expect anyone to enter into REM so quickly. And if they do a certain percentage, it's diagnostic. Okay, you have to rule out sleep deprivation, which of course, unfortunately, for this particular character, does complicate or confound things. But the multiple sleep latency test is a bunch of mini naps that the tech wakes the individual up. I think it's like 10 minutes. I'll double check the time, maybe 30 minutes, but it would be pathologic to enter into REM so quickly. She clearly does. She's well within that threshold. Multiple sleep latency test. There's a scene that she confronts her mom, who's still, and we certainly could talk about Marge and her illness, which is likely alcohol use disorder. There might be a reason why Marge is afflicted with alcohol use disorder beyond her daughter having been victimized by Freddie at a younger age. And it has to do with the hat that she finds. She tells her daughter she threw it away. The daughter confronts her with it and points out that this is his hat because it has his name written in it. And I just thought that it was very, very weird that the name in the hat was Fred Krueger, while literally tens of millions of people know him as Freddy Krueger.
They might have had a relationship. Yeah.
Remember, the mom and dad here are separated. And now we could speculate why. Right? Fred Krueger may have been an ex-boyfriend. And Marge may not have known what he was doing and may have profound guilt over that. Alcohol use disorder. If Marge presents to you, in the context of psychotherapy, of course, might there be other medications that you as a prescriber might suggest would be helpful as part of a biopsychosocial treatment plan for Marge?
Specifically pharmacological therapy?
Yeah.
Naltrexone.
Good, naltrexone. So you want to prescribe her naltrexone? What's your main goal with naltrexone other than day sober? Like what is it that you'll talk to your patient about as to why you're recommending this medication as part of a biopsychosocial sobriety program?
It reduces cravings, doesn't it?
Yeah. Right. It's a mu opioid receptor, so it has FDA approval not only for opioid use disorder, but also alcohol use disorder, because it cuts down on cravings of or for opioids as well as alcohol. So sure, you could prescribe that. If Marge focuses on the craving for alcohol, and therefore your treatment plan certainly is going to in part focus on that, but for whatever reason we don't feel as if she is compliant with PO meds, might there be an option here for you? So the once monthly injectable of Vivitrol might be considered. Vivitrol is naltrexone in a depot form. It's a long-acting injectable. Any other medications available for Marge? disulfiram. Disulfiram works from a completely opposite, well, not opposite, but different mechanism. This medication, disulfiram, otherwise known as Antabuse, inhibits the rate-limiting step of alcohol breakdown, and therefore, by inhibiting acetaldehyde dehydrogenase, increases levels of acetaldehyde when you drink while taking this medication, while taking disulfiram. The buildup of acetaldehyde will result in a toxic reaction, the disulfiram reaction, which includes what?
Flushing, diaphoresis.
How do you flu-like symptoms?
Vomiting. And as a result, the patient will learn that they are not going to drink when they're taking this medication as directed. That form of learning is what? Good for you, positive punishment, all right? It has to be punishment because it reduces a behavior, specifically drinking, so it cannot be reinforcement. And something was added, the prescribing of the pill, therefore it has to be positive, right? Positive punishment. Third medication, FDA approved for the treatment of alcohol use disorder is a Camprosate or Campril. By the way, how's that metabolized? Well, that's quick. It works by a mechanism of action different than that of naltrexone. So while both will reduce craving, they can be co-administered because it's a different mechanism. So all three can be prescribed to the same person, and maybe Marge would be amenable to that as part of her aftercare plan, which should include psychosocial rehabilitation as well, including AA. I also did a bottle count. I mean, number of scenes Marge is drinking versus the number of scenes she's in where she's not drinking. I have that in my PowerPoint as well. She has alcohol use disorder. Okay. Despite that, though, it's probably worthwhile saying, because this is something that is a myth. Frequency of drinking, although Marge overwhelmingly drinks and the scenes in a Nightmare on Elm Street, frequency has nothing to do with the diagnosis. Right? You need 2 or more symptoms from a symptom set. And by the way, did you take the surveys yet for learning that symptom set? Because if you haven't, do that today. Okay? Nobody leaves here without doing that today. That causes clinically significant impairment in functioning. That's it. Whether that's one time a month, whether that's one time a year, doesn't matter. All right? So a lot of times our patients will tell us, but doc, I don't drink every day. Unfortunately, that's meaningless. Right? Any other characters you want to discuss here? So we've discussed Marge's alcohol use disorder, Nancy's post-traumatic stress disorder, and narcolepsy. Freddie's, now that we know it's pedophilia, right? By the way, what is pedophilia? How's it defined in the DSM?
Just like 5 years younger if they're both greater than 18.
Yeah. So the American Psychiatric Association does have specific age parameters that differ than other publications, including the World Health Organization. But it's sexual gratification with regard to interacting with minors. And again, I would review the DSM criteria. I don't think the shelf really gets into the specific ages because of there being different with regard to the different publications. What I do need you to know, though, is that pedophilia is a paraphilia, and that is it's a sexual deviancy that causes clinically significant deficits in self or others. And paraphilias are one of 3 types of sexual disorders in 3 separate chapters of the DSM previous to 2013. It used to be 3 different parts of a single chapter called the sexual disorder chapter. DSM-5 in 2013 separated them into 3 discrete chapters, one labeled or titled the paraphilias, the sexual deviancies. Do you know what the other 2 chapters are? Sexual dysfunctions. For sexual dysfunctions and prepping for your shelf exam, what I would recommend is that you Google and bring up an image of the sexual response cycle. Get out your favorite board review text and have a visual as you're studying, right? Because each stage in that sexual response cycle has at least one of the mental disorders attached to it. So it's an easy way of learning those. And then the third and final is a gender identity, it's formerly known as gender identity disorder, now known since 2013 as gender dysphoria. Right, so three separate chapters, formerly known as the sexual disorders. Freddy Krueger, pedophilia, which is a paraphilia. Any other characters discussing A Nightmare on Elm Street?
Wasn't there one character that was always using a lot of Adderall? And I know that he was trying to stay awake, but it's possible that that's something that he used prior as well. And he also ran out of his prescription. So how much was he actually using in that short period of time?
Was that the remake or the original?
The remake.
Remake? Yeah, could be. I don't know, and I didn't see the remake. I have to be honest with you. The original, it's Nancy herself that uses caffeine pills.
Oh.
Yeah, but again, the interesting thing to look at here, and it's good that you brought this up, is that upon further inspection, this is not a substance-induced sleep disorder. That is, it's not a caffeine-induced sleep disorder. So caffeine can induce mental disorders. Matter of fact, caffeine can induce two known mental disorders. One is insomnia, the other one is anxiety. Good. And quite frankly, I think that Nancy has both. Having said that, while that should be the first thought we have in the evaluation of this character, since her nightmares predate her taking that first dose of caffeine, this cannot be a substance-induced, a caffeine-induced sleep disorder. Now, remember that when we formulate the most likely diagnosis, we can formulate it biopsychosocially, and we can formulate it with regard to the 3 Ps, right? Predisposing, precipitating, and perpetuating factors. In this case, the role of the caffeine pills, God bless you. The role of the caffeine pills is not only bio with regard to biopsychosocial, but also perpetuating, right? That is, the sleep disorder was predisposed / precipitated, but now it's perpetuated by the caffeine. So it does play a role nonetheless. Any other characters in Nightmare on Elm Street?
Just going back to Nancy, is it also possible that I think narcolepsy is a better diagnosis just on the basis of everything that we discussed, but is it possible that she also has REM sleep behavioral disorder?
Yeah.
Because I'm thinking about that scene, the same scene that we talked about when she was convulsing. That disorder, you typically have loss of, you're unable to be paralyzed and you have these convulsions, you're able to act out your dreams. Is it possible that she also, I mean, at least that would be in the differential.
Yeah.
She remembers them too.
Yeah.
So.
Absolutely, yeah. That would be very high in the differential. That would be. Again, in REM sleep behavior disorder, you have people who fail to have atonia during sleep, muscle paralysis during sleep. And that failure results in their sometimes acting out their dreams. And that could certainly be going on here. Yep, it could be. If it were, I want to put that, though, just below narcolepsy, not the least of which is because I want you guys to remember that narcolepsy has genetic susceptibility. Again, parents caused the nightmares for these kids in this movie. The onset is usually adolescence, nailed in this movie. 1-to-1 sex ratio, nailed in this movie. So if you bring home those teaching points of narcolepsy because you've watched this movie, I think this film has definitely served its purpose.
So if it were REM sleep behavior disorder, could you assume then that these were all individual suicides following a shared delusion?
Yeah, that would be the problem too. Yeah. I don't know why, and you could look at it from either perspective. I don't know why these 4 friends would all have narcolepsy. Nor would I know why they all have REM sleep behavior disorder. I'm at a loss. Yeah. It's a diagnostic curiosity.
They could have different things. In the 2010 version, at least, one of the characters says the first character to die is Dean, and another, I think Jesse says Dean was on a ton of medication, and so for some of them it could be maybe substance-induced psychosis.
Yeah, I couldn't even contribute. I never saw it. I'd have to watch it, and which might be it might be a prompt to watch. If you could, are there 4 characters in the remake as well?
Yeah.
I mean, if all 4 had a different diagnosis, it would allow for teaching 4 then separate illnesses, which again, for didactic, would probably be a better idea.
And it's
So-
on Netflix. And I
Yeah,
think
that's
how
why
a lot
I
of
watched
Yeah,
it.
watch Netflix.
I was like, oh, he wants the Netflix one.
Yeah, I'll get around to it. Is it, and it's a remake too. It's not a sequel. It's just, you're talking about
It's
the
a
remake,
remake.
right? Okay. I'll put it on my list. Any other thoughts? We're good? All right, we're gonna sign off here. Be back on Friday. Friday is Friday the 13th. All right, so we'll discuss what Friday the 13th is about, and I will tweet the Seinfeld episode ASAP. Get that. See everybody back on Friday.